Imagine going to bed feeling just fine. No pain, no dizziness, nothing out of the ordinary. Then you wake up in the middle of the night unable to move your arm, slurring your speech, your balance gone. A stroke. And not from smoking, a bad diet, or lack of exercise. But from something you thought was helping you. A vitamin. That's right. A simple, innocent-looking supplement sitting in your bathroom cabinet could be silently raising your stroke risk while you sleep. I know how wild that sounds. But, as a brain doctor, I've seen it too many times to ignore. The very thing seniors take to stay healthy, vitamins, can, in some cases, push your body into a dangerous state without any warning signs. In this conversation, we're going to explore the hidden side of 5 common vitamins: D, E, B6, A, and niacin, and how, if used incorrectly, they can quietly turn into ticking time bombs for your brain. Not to scare you, but to empower you. Because knowing what's really going on inside your body can be the key to staying independent, mobile, and mentally sharp. Let's start with vitamin D. You've heard the praise: it strengthens bones, supports immunity, boosts mood. That's all true, when it's taken in the right dose at the right time. But here's what most people never hear. High doses of vitamin D, especially when taken late in the day, can quietly raise your calcium levels and stiffen your arteries. That alone wouldn't be so bad, except that stiff arteries mean your blood has a harder time flowing through your brain. Now imagine adding dehydration from sleep, low nighttime blood pressure, and then bam, a clot gets stuck. A stroke happens and you never saw it coming. I had a patient once. Walter, 74 years old, retired Navy healthy eater, took his vitamins religiously every morning. But one night his wife found him barely responsive. He'd had a stroke in his sleep. His blood work showed dangerously high calcium levels and high vitamin D, 10,000 IU daily. He wasn't careless, he just didn't know. And the truth is, most people don't. Over-the-counter supplements often contain far more vitamin D than you need, and when you take too much, especially if you're also taking calcium or heart meds, the consequences can be devastating. The safe upper limit for most older adults? Around 2,000 IU, and even that can be too much if you're not deficient. And never ever take it before bed. Next up, vitamin E, the so-called heart helper. It's supposed to protect your arteries, improve circulation, even help your skin. But did you know that too much vitamin E can actually thin your blood? That's right, it acts like a natural blood thinner, and when taken with medications like aspirin or warfarin, it can raise your risk of internal bleeding, especially in the brain. Evelyn was an 81-year-old former librarian who took pride in staying sharp. She was on blood thinners for a heart valve issue, and one day she picked up a bottle of vitamin E, 800 IU per capsule. A few weeks later she was rushed to the ER with a brain bleed. She didn't fall, she didn't have high blood pressure, her brain just bled from the inside. The supplement had quietly made her blood too thin to clot. The recommended daily amount for older adults? Only 15 mg, about 22 IU. But most supplements you find on store shelves contain 200, 400, even 1,000 IU. No warning label, no mention that you should avoid combining it with blood thinners. Evelyn survived, but her life changed forever. And she said the same thing I've heard from so many: I thought I was doing something good. Then there's vitamin B6. You've probably seen it labeled as a nerve support or brain booster. Maybe someone told you it helps with energy or focus. But here's the hidden danger: too much B6 can actually damage your nerves, permanently. Harold, a 76-year-old former trucker, came to me complaining of tingling in his hands, numb feet, and losing his balance. At first he thought it was just age or arthritis. But when we dug deeper, I found he was taking a nerve support formula. 200 milligrams of B6 daily. That's over 10 times the upper safe limit. Vitamin B6 builds up in the body over time, and once the nerves are damaged, there's no easy fix. Tingling, weakness, tremors, it all crept in so slowly that he never suspected a thing. And by the time he did, it was too late. He stopped driving, he walked with a cane, all because of a supplement meant to help. The safe amount for seniors? Around 2 to 10 milligrams per day, including what you get from food. But supplements often contain 50, 100, even 200 milligrams. Always check the label, always. You might be thinking, well, at least vitamin A is safe. I've heard it's great for my eyes. Yes, it is, in small amounts. But too much vitamin A, especially in fat-soluble form like retinol, builds up in your body. Over time, it can increase the pressure inside your skull, mimicking the symptoms of a brain tumor or stroke. Dorothy, a 79-year-old piano teacher, started having headaches and blurry vision. Her speech slurred, and her family thought she was having a stroke. But imaging showed no clot, no bleeding, just increased pressure inside her brain. She'd been taking 10,000 IU of vitamin A daily for years, thinking it would protect her vision and skin. Instead, it was harming her brain. Vitamin A doesn't flush out like B or C vitamins, it stays stored in your liver and tissues. And as we age, our body's ability to handle it decreases. The upper safe limit, around 3,000 IU daily. And that's only under medical guidance. Finally, let's talk about niacin, vitamin B3. You've probably seen it advertised as a natural way to lower cholesterol. Sometimes it's even prescribed. But what no one tells you is that high-dose niacin can cause extreme swings in blood pressure, flushing your face one moment and constricting your blood vessels the next. Frank, 82, had a strange mix of symptoms: flushing, dizziness, chest pounding. He thought it was his medication, but the real cause? A heart health supplement with 1,000 milligrams of niacin per dose, taken twice daily. That's 2,000 milligrams, 60 times what most seniors need. Eventually he suffered a mini-stroke. His speech slurred, then returned. A warning shot, a lucky one. He'd been unknowingly stressing his arteries and his heart for months. Niacin above 50 milligrams daily should only be taken under supervision, especially if you're on blood pressure meds or have heart conditions. Even flush-free versions can cause issues, and most people don't realize that until it's too late. So what's the takeaway? Are all vitamins bad? No, not at all, but they're not candy. They're powerful chemical compounds that interact with your body, your medications, your organs. They need to be used with care, with guidance, and most importantly, with understanding. But here's the good news. Your brain doesn't need mega doses of vitamins to thrive. It needs balance. It needs hydration. It needs real food. Margaret, a retired principal, used to take more than 7 supplements a day. She still felt tired, dizzy, foggy. We swapped the pills for a better breakfast. An egg for protein, avocado for healthy fat, blueberries for antioxidants, and a slice of whole grain toast. Within weeks, her energy returned, her balance improved, and she felt sharper than she had in years. Spinach, salmon, nuts, seeds, berries, water, these aren't just foods. They're medicine in their most natural, powerful form. They don't overload your system, they nourish it, and they protect your brain without putting it at risk. So if you've made it this far, here's the one thing I want you to remember. The most dangerous pill is the one you never question. Ask, check, read, and most of all, listen to your body, because sometimes it whispers long before it screams.